On today's podcast, we are welcoming Jenny Russell. Jenny Russell is a registered nurse who lives in Tennessee and had a prior infertility journey 5 years ago with her ex-husband. She recently became unexpectedly pregnant through a different relationship and took the evidence-based birth childbirth class as a single parent without a support person. Heidi Duncan, her EBB instructor in the childbirth class, was both her childbirth educator and her doula and support person. Jenny works full-time as a clinical analyst in evidence-based nursing documentation. She's also a full-time caregiver for her mother who has early onset Alzheimer's. Welcome, Jenny, to the Evidence-Based Birth Podcast.
Thanks, Rebecca. I'm so happy to be speaking with you today.
So tell me, Jenny, a little bit about your journey. I know you were willing to share a little bit about some of your prior difficulties before you got pregnant with this pregnancy. So you had some infertility problems earlier in life, correct?
Sure. Yes, I did. I have a uterine septum, which I had resected, and my ex-husband had an extremely low sperm count. So we suffered through infertility in 2014 and 15. And as that ended, my ex-husband had an affair and left. And so going through that infertility journey was something else. And then to unexpectedly get pregnant was just another curveball in my life. So.
Yeah. And so you had tried fertility treatments then with your ex-husband?
Right. We went through a failed cycle or a canceled cycle at 10 days of actually giving myself medication. I was not producing the amount of eggs that they wanted, that they expected from me. So we made the very hard decision to cancel the cycle at that point. And then from there, had a lot of depression after that. And that was kind of the unraveling of our marriage.
Okay. So shortly after that, you two split apart. And then later you became pregnant unexpectedly through a different relationship. What brought you to the evidence-based birth childbirth class? Well, let's scoot back a little bit because I think you wanted to tell a little bit about what happened when you got pregnant unexpectedly with someone else.
Sure. So I had recently actually acquired guardianship of my mother, who has early onset Alzheimer's, about the same time that I started a relationship with my son's father, and unexpectedly got pregnant about 8 months into that relationship. And he was not game to have another child. He has a 12-year-old and did not want another child. And so he was pressuring me into an abortion. He really, really wanted me to have an abortion. And when I refused a week after I found out that I was pregnant, he dumped me.
So you were entering the rest of your pregnancy alone, essentially, while also caring for your mother with Alzheimer's.
That's exactly right. And one day I saw on Facebook that there was a natural birth, which it's questionable, but a natural birth meeting at a facility near me. And I wanted to go to that because I had somewhat of an interest in an unmedicated birth. My mom had 4 unmedicated births. So I kind of always had that on my radar, but I wasn't totally sold on that. So it ended up being an ICANN meeting. And then Heidi was there as part of the audience that day. She wasn't even presenting or anything. So I met Heidi Duncan, who I immediately watched her in action through that class, just talking to people. And I was very impressed with her. And so I asked her after, I think I was only about 16 weeks pregnant. And afterward, I didn't want to do the dating. They do a doula dating, like the speed dating thing here. And I didn't really want to do that. And so I asked her if she might be interested in being my doula and got to know her a little bit better. And then found out that she also taught the evidence-based birth class. And I was so excited to take that because evidence is part of my job. It's just part of who I am and what I respect as a nurse and a person. So I was very excited to take that class with her. So I was about 16 weeks then, and she agreed to be both my doula. We did her normal screening interview and everything. And then from there, I was, my 20-week anatomy scan. I went to see my OB after that, and I went to see my doctor afterward, and she told me everything looked great. Everything was great. And I saw her in the office another time at 24 weeks, I believe, and told me she was scheduling me for a 28-week ultrasound, which was not in our plan. She said that I wasn't going to need any other ultrasounds unless something was wrong. And so I asked her, unfortunately, not an open-ended question. I asked her if she was planning to check for uterine growth restriction because of my septum, and she said yes. A couple of days after, I think I was about 22 weeks maybe, I got a notification that there was a new condition added to my portal. And I went in to look at that, and that was choroid plexus cyst, fetal is what it said. And it threw me for a loop. Evidently, that showed up on my 20-week anatomy scan, and that's why she was scheduling me for a 28-week ultrasound. It was that and possible brachycephaly. And so I was wrought with anxiety in my single mom life, taking care of my mom. How was I going to manage all of that? And I was really upset that my OB had not spoken to me about it.
Wow. So she hadn't said a word to you about the things that were flagged on the ultrasound?
Exactly. Not only did she not say a word about it, but when I asked her why she was scheduling that 20-week ultrasound, she confirmed that what I had suggested, which I would now, in hindsight, I would ask an open-ended question in that scenario. But she said that was the reason, and it was just a shock. As soon as I saw that on my portal, I messaged there that someone needed to call me ASAP because no one had discussed that with me. And unfortunately, she sent a message through the portal. I think she thought she was sending it to her nurse, and it said, I thought that I discussed this with her. Please call her, And so it was a nurse that called me, not even my doctor, who had made the error in the first place. So at that point, I started looking for another OB. And I sneaked in as a nurse to a birth event here, which was an awesome panel discussion on collaborative care at the birth center. And I asked a couple of midwives who they would go to. And I got a recommendation on another OB. And I was very excited to start with that practice because that seemed like a more holistic practice and certainly what I was more looking for more in an OB. And at first, things were great with that OB. I discussed that I had a history of sexual abuse and I wanted only informed consent, it was very specific in, I wanted to discuss any kind of procedures and everything before she did any procedure with me, and I wanted to give her informed consent. I told her that I didn't want any cervical checks, and she said, that's fine. I don't even offer them until 36 weeks anyways. And then 35 weeks and 4 days, I was in for an appointment, and she was going to do my GBS swab. And she said, okay, I'm going to do a cervical check. And she basically forced that upon me. And it was very painful and completely unnecessary. And I didn't stand up for myself. And it was very traumatic, very, very traumatic. And so
she basically went in, and while she was doing the swab, she said, I'm going to do this now, and then did it to you without asking
consent, period.
Yeah.
Yes,
wow. And she knew you had a history of sexual trauma.
Yep. And I think being a nurse and knowing kind of the background on that a little bit, she was going on vacation the next week. And I really think she wanted to have in the chart, where I was, which obviously, as we know, really doesn't matter at that point. I was not in labor.
Yeah, you were still technically preterm at that, early. You want to go into labor that day anyways. Exactly.
And I had a little bit of bloody mucus afterward and a lot of pain because she basically had to use her whole hand in my vagina because my cervix was so posterior and so hard to get to. So it was just very, very upsetting. So at that point, I was like, oh my gosh. At that collaborative, I had met another person, very, very influential person in my journey, who is executive, very high in where I was going to deliver. And I talked to her. They were starting a midwifery program at the hospital. And I was like, I basically just explained that I would prefer to deliver with a midwife anyways. I had always gone with an OB because I was concerned about the septum and how that would look at the end of my pregnancy, but everything was going very well at 36
And
weeks.
at this point, what were they saying about your baby's cord and the concerning things that showed up on the anatomy scan? Did they decide that was not accurate or what?
Correct. Exactly. Sorry about that. the second OB did do an ultrasound. And that was one of the reasons I was very impressed with her, because she came into the office or into my room after the ultrasound, and she had already called the radiologist to confirm that they were specifically looking for those things because it was a different practice and they didn't have the old images to look at, et cetera. And there was absolutely no signs of either of those issues.
So now you're at 36 weeks.
6 weeks.
And your doctor has basically just violated you during your prenatal visit, and you're looking for someone else. You're looking to switch care 4 weeks before your due date.
Exactly. And as a first-time mother, so I had no idea what was going to happen, and it was so scary. And being a single mom and caring for my mom and working full-time, it was just very, very hard. So Heidi and this other person worked very, very hard to get me connected to the midwife that was going to be practicing in that midwifery group at the hospital. And somehow all of the stars aligned, and this midwife agreed to accept me. Except there was one issue. She wasn't fully credentialed at the hospital yet. So she had to have an attending OB that would agree to take our case. And so fortunately, she found an OB that was willing to do that with us. And so I met my midwife on Friday. I just went to a coffee shop and met her because she wasn't, fully. Actually, I wasn't legally going to be her patient.
So this was going to be the first, I think you told me a message, the first midwifery practice at a large hospital. So this hospital did not have midwives before this.
That is correct.
And so she was just starting there, but hadn't gotten credentialed yet. Okay.
Right, exactly. She has a ton of experience, but just not at
that hospital. Okay.
Right, exactly. So she met me for a couple hours, and we discussed, all of the things in my life. And that was on Friday. And then I had an appointment with the OB that was going to be me on Monday. And this is all a week before my due date. I think I was 38 weeks when I found out that I was going to have a midwife after all, and 39-ish when I got to meet my providers. So I met my OB. She actually spent 2.5 hours with me in the office, and she is trauma informed and was fantastic with me. She said, normally she would spend that much time with a patient just over the 9 months. And so she was wonderful. So I met her on Monday, and then I went into labor on Wednesday.
That's so incredible that you were able to switch care a couple days before you went into labor. Let's rewind back a little bit to the evidence-based birth childbirth class, because some point in there you received that education. So tell us a little bit about what that was like.
Thank goodness I received that education, because I think I was a little early taking the class, a little bit younger gestation than most of the other people in my class, and I think most people that take it. But I was very anxious about everything, and I wanted to have everything in place before, considering my situation. But I just I can't imagine not having taken that class. I learned so much about everything, and I'm a nurse, and I had a broad knowledge of things, but nothing detailed. I've never worked in the birth world at all. I mean, it completely changed my mind on having an unmedicated birth. I wasn't completely sold on it. I had a friend who had just delivered and had an epidural, and she was like, "You'd be crazy not to have an epidural." And she's a pharmacist. And just learning all of the cascade of interventions and how that affects not just me, but my baby, just changed my view on all of those things. And now I knew what I wanted to push for and fight for in my birth, during my birth. And Heidi was awesome. She was an awesome instructor. I loved that it was a mixed class. For some of it was virtual and some of it was in person. That was awesome, because for my lifestyle, it helped for sure. It helped me be present. It was hard taking the class by myself, and thinking through the acupressure and things like that. I didn't really have anybody to practice that with. So Heidi helped in some of that, and was my partner through the class, the in-person class, and helped, which was great.
Were you able to use the recordings that I made of the relaxation practice?
Oh, yeah. Yeah, I love them.
Okay, yeah, because for people who don't have someone who can read to them, I recorded the relaxation practices. So those were helpful.
That was perfect. Exactly. Yes. And I was so grateful, exactly, because I didn't have anybody to read that to me. So you did. So thank you.
You're welcome. It was fun putting those together. I actually worked with a music therapist to kind of pick some music. And then I reached out to those musicians to even pick out the background music for the relaxation recording. So it was fun to put those together.
That's awesome. Yeah, they were wonderful. And also the evidence-based birth playlist on Spotify. I use the acoustic playlist so much, and that'll be a little bit part of my story, but I still love that to this day. I listen to it all the time.
Oh, that's awesome. Me too. It's one of my top lists on Spotify.
Yeah, same here.
Yeah, and that was also developed with the help of Kate Taylor, who's a board certified musical therapist and a doula. So yeah, shout out to Kate for helping us with that.
Yes. Thank you so much. I enjoyed both of those, the relaxation and the playlist for sure.
Okay, so take us to the day or so before labor started. You'd finally, after several switches, found the right team, the supportive team to care for you. What was your mindset like at that point?
Well, so Monday I was stoked. I left. Heidi went with me to my appointment to meet my OB. And then afterward, we actually went to the hospital because she hadn't been in that hospital for a bit. And so we went to the hospital. A nurse showed us around. We took a little tour. I kind of talked about my story and everything, and she was great. Then Tuesday came and I was on Facebook and I had a plan for my mom when I went into labor, sort of. Her friend was going to take care of her and hang out in the waiting room or in my room as needed. And then she was going to stay in a hotel with her close by and bring her to the hospital so she could be close by and, and be part of all of this. And not knowing when I was going to go into labor, of course, it was very hard planning all of this stuff. And I saw a Facebook post that she had a temperature of 103 and was going to be admitted to the hospital. She has a liver transplant. So
the friend who was going to be the caregiver for your mom while you were in labor. Yep. Oh my.
Yep. So freak out. I'm texting Heidi the night before. I'm sitting at my counter in my house. I bought a house and moved in about 7 or 8 months pregnant.
And for people who don't understand, when you're the primary caregiver for someone with Alzheimer's and there's nobody else, you go into labor, you can't leave her. And
exactly.
And she can't necessarily come with you.
Exactly.
That's a huge dilemma.
Somebody suggested I leave her in the waiting room and have the nurses check on her, which made me laugh, especially being a nurse. They're barely able to take care of their patients, much less a family member. So yeah, it was very scary. I'm like, I don't have any family in the area. So it was very scary. And I just cried at my island at my house and texted Heidi. And Heidi was like, it's going to be okay. She's like, I really think you should talk to my backup doula. She's done some of the sibling doula work, I believe. And she's wonderful. And so I thought that was a very good plan. And that was Tuesday, though, and I was exhausted and I went to sleep. And I was awakened at about 3:30 in the morning with labor pains. I was like, is this really it? Because as a first time, you never know. I had been having a lot of contractions anyways, and so I didn't know for sure for a little bit, and I waited maybe a half hour or so, and then I texted Heidi. I was like, I'm pretty sure this is it. So I was having contractions about every 4 to 5 minutes and at 3:30 in the morning. And so she said, I think this is it. And so she came to my house. I think she got there about 7 maybe. We're over an hour away from one another. So she just jumped right in and started supporting me. I have trouble remembering what those pains are like, which is fascinating to me. I'm 5 months postpartum now, but I do remember in the moment they were extreme, and she was so wonderful. I don't know how I can't remember how to breathe properly from 3 to 4 minutes apart for each contraction. But I swear every single contraction, she reminded me exactly how to breathe and how to moan through the pain and get through it. She was just invaluable. She had me in my big bathtub at one point, and the faucet was leaking and dripping and driving me nuts as a laboring mom. And so she came up with a solution for that. She just had a solution for every single issue that arose that day. And it was just amazing. She had me in different positions as I labored all day, and we were suspicious that I wasn't really progressing much. And she got me into some weird positions to try and move the baby, and she just supported me so well during my labor. It was just amazing. My mom came in the room a couple of times and gave me a report on what my dog was doing. So she wasn't very attuned to what was going on that day. And so she just kind of hung out in the house that day. But then when it was time to go, Heidi had set up, she had been texting, in addition to supporting me, she had been texting her backup doula and had arranged for her to take care of my mom while I was in the hospital.
So did you bring your mom with you, or did your mom stay home? Okay. So your mom came along so you had Heidi as your doula and then the backup doula caring for your mom.
That's right. Exactly. So Heidi actually drove us to the hospital, because that was another thing. I didn't really have anybody to drive us to the hospital.
Yeah.
And that was another really scary thing, and if Heidi hadn't gotten to come, if labor hadn't gone the way that it did, I didn't know what I was going to do exactly. So, and I'm about 35 to 40 minutes from the hospital during non-rush hour. So
what happened when you arrived?
So I labored all day from 3:30 in the morning till about 9:30 at night. And then we decided to go to the hospital. And Heidi had been in touch with my midwife, but maybe also with my OB, or everybody was talking. But fortunately, I didn't have to be involved in all of those conversations. So we got to the hospital about 10. My OB was sitting at the nurse's station waiting on me, as was the nurse that took Heidi and me on the tour. She had switched days and was working night shift that night. And much to my surprise, she was my nurse that night. So it was wonderful. I just walked in there like, oh my gosh, how is this happening? And so she took me to my room. Heidi was there with me, obviously. My mom was in there for the first part, and they got me all settled. I did allow the nurse to start an IV on me. That was something that was very questionable for me. I was torn between my old nursing shoes and knowing how nervous I was when patients didn't have an IV, and the evidence. I did allow to have just a saline lock IV. From there, Heidi and I walked the halls a bit while we waited for my midwife to show up. And then everybody knew about my history of sexual abuse, and both my midwife and my OB were very, very patient with me about having my first cervical check, and appreciated that so much, so very much. And had I not known the evidence on cervical checks, I probably would have played along as a good patient. Kind of tend to fall into that role a lot, even though I'm a nurse. So I was very grateful to know exactly when I wanted that done, if at all. And so we talked through that. So I labored for quite a while before they ever did my first cervical check, actually. Walked down the hallways, and I think I sat in the rocker, maybe in the room, and everyone knew that my goal was an unmedicated birth. And once my midwife came, they decided that I needed my first cervical check to see, because I think maybe everybody was suspicious that I wasn't progressing. And of course, I just, at that point, was just entirely a patient, and I had no nursing skills whatsoever. So it was really nice to be able to take that hat off, because I had good providers that were going to take care of me that I felt comfortable with. And so they did my first cervical check, and I was only 4 centimeters dilated. And I think I was fully effaced at that time. And so my OB did the cervical check, and she felt a ring of scar tissue around my cervix, and they were suspicious that I wasn't going to be able to progress anymore without breaking up that scar tissue. So I had been laboring pretty well until then. And
so they were thinking that the scar tissue in your cervix is why labor had been going on so long with such strong contractions, but not progressing past a 4.
Exactly. And so at that point, my mind started going to the negative. I just started thinking about all of the things in my past. And how much I'd struggled and how I was going to have a baby. And I was so excited about that. But all of these things kind of came crashing down on me.
It was almost like your past was haunting you in this moment in a way.
Exactly. And so they discussed with me that they'd like to just go in with their fingers and break up that scar tissue. And I'm not sure who said that, but who said it in the room. But I think somebody said that most people would have an epidural at that point. But I had set my mind to have an unmedicated birth, and I really didn't want to do that. So for a while, I thought about it and kind of worked through that, the pain of the past, the emotional pain. And I decided that I was going to turn on my evidence-based birth playlist and play my song that I dedicated to my son, which is Hold You in My Arms by Ray LaMontagne. And that's the first song in the playlist. And I just put that on repeat. I put my earbuds in and I laid back in the bed and I let the midwife clean that scar tissue up or break up that scar tissue. And then sure enough, after that, labor went into full force. But I just got into the zone, in my mind. Some of the relaxation meditations were going on, and I was just singing that song to my baby that I was about to meet. And I just sat back and relaxed and let her do what she needed to do. And it was just an incredible experience. It was the most cathartic thing I think I've ever been through.
To be able to make it through that?
To be able to make it through that, because I was in control at that point, and learning all of the evidence behind everything, and having the confidence of going after the goal that I had set, because I knew that I could do it. It just put me in the right space to be able to push through all of that. So
wow.
It was amazing. Yeah. So when I wiped my tears for a second. And so my labor was progressing pretty well. My midwife had me in the shower.
After the scar tissue was broken up, you started progressing well?
Yeah, exactly. I don't know if we ever did another cervical check until we were pretty far along, but they brought me into the shower so I could labor in the shower, and it was quite a sight because the hospital had ordered new shower curtains and they were too short. So there was water everywhere. My midwife and Heidi had water up to their calves on their pants. They had rolled their pants up. Everybody was just wet, but they were just in that space with me and were just amazing. It didn't matter that they were getting wet. They were there supporting me, and it was just incredible. The handheld shower didn't work too, of course. Of course, I would have that room. And so, I had to stand in the shower, right in where the water was coming out. But that was great, just experiencing that. The hospital where I birthed didn't have tubs, or else I would have been in the water there. So,
which I guess is not surprising if they hadn't had midwives.
Right, exactly. But they're getting tubs pretty soon, I believe. They're changing a lot of their practices, and they have a very important person at the top that has a lot of experience in the birth world and has a lot of great things to bring to that space. So I'm very excited for the future there. I wish that it could have been before I delivered, but such is life. So we labored in the shower for a while. I used the bar to do some squatting in the bed. I was on my side some, and just all different positions that we had learned in class. And I thought I liked side lying with a peanut ball when we were practicing, and that turned out to be the position I hated the most. So it was kind of funny, but I was in such a good space, all except for that one time when I found out about the cervical scarring. But besides that, for the most part, my labor was just so cathartic, and I was just in such just an incredible way in that room, knowing that I was going to finally meet my baby and getting to use all of the things that I'd learned. It just was incredible. Having the right birth team there, it was just incredible. As I think about it, it's just it makes me so happy to think back on my birth. It was my birth and my baby's birth,
So take us to that moment then, the moment of birth.
I wanted to tell you about my water breaking though, because I had a midwife and the right support. I was able to go to the bathroom during my labor. So I went to the bathroom and I was sitting on the toilet and I was like, oh gosh, I need to push. My midwife said, okay, it's okay. Go ahead and push. And so I needed to pee desperately, but every time I would relax enough to pee, I would have another contraction. So I pushed a little bit sitting forward, and then next thing I'm like, that contraction left. And then I was like, oh, I told her, every time I relax enough, I get another contraction. She said, turn around backwards on the toilet. So I turned around backwards on the toilet, and then immediately another contraction hit, and I pushed, and we hear a pop and then sploosh. And then I think we looked at each other first and then looked into the toilet to make sure there wasn't a baby in the toilet. Fortunately, it was my water breaking. So my water broke over the toilet quite conveniently, but there was meconium in it. Another part of my birth was that the monitors really, really bothered me. They hurt everywhere that they would touch my skin. It felt like when you touch your tongue to a 9-volt battery. Like it just hurt me so badly. So my nurse was amazing. Instead of strapping the monitors on, she was just holding them on whenever they needed to. But of course, the meconium in the stool meant that they were going to need to check a little more frequently. And I was okay with that, And so, but it was only, I think it was about a half hour from my water breaking to me actually birthing my son. So I was back in the bed. My midwife said, I think you need to be on your right side with the peanut ball. And I said, no, any position but that. But she said, well, I'm pretty sure if that's your reply, then that's exactly the position you need to be in. So that's the position I got into, and I started actually getting to push. And so I don't remember a whole lot about pushing. I know Heidi was there with me and helping. I know that I was crowning, and then the next thing I really remember is my OB saying, okay, Jenny, reach down and grab your baby. So I guess they had decided that the OB was going to catch, but my midwife was right there. So I never expected, I wanted an unmedicated birth, but I never expected like the birth center kind of experience. I was ready to push for like a minute and a half of delayed cord clamping, but she actually said to me, reach down and grab your baby. And I was just like, oh my gosh, so I reached down and grabbed him and put him to my breast. And then it was just amazing. He was trying to suck already. And I'm just laying there with my baby, and I'm just thinking, oh my gosh, this is incredible. He's right here. I met him. He's here, as I was coming to. And then the next thing I know, the OB said, Jenny, I think it's time to cut the cord. It's been 6 minutes. And I was like, what? 6 minutes? I'm like, oh my gosh, I didn't even have to fight for that. All of these things that I'd prepped in my mind that were going to be a struggle for me and a fight just fell into place because I had the right providers there with me and a nurse that was supporting me in my unmedicated birth in the hospital. So I would have preferred to deliver at a birth center, but that wasn't an option for me. So
what time was your baby born then after this long journey?
5:51 in the morning.
So almost a little more than 24 hours after your labor began.
Right. Exactly. Yeah. And yeah, it was just incredible. I think his Apgars were 8 and 9. And he was a healthy little boy, but I would not let anybody weigh him or take him away from me. So we didn't do that until we got to postpartum after they transferred me. So yeah, it was incredible. It was incredible. At one point, I did forget to mention, my midwife realized that my mom might be impeding my progress too. And she suggested that maybe my mom should go to the waiting room. And I was like, yes, can you make that happen, please? And she did. And so my mom went to the waiting room with our other doula, Marcy, who's fantastic as well. And once they left, I felt a little bit more comfortable. And I was just thinking back, like, that was incredible that the midwife that met me on Friday recognized that. But that's what awesome birth workers are, just amazing. Like, they just know these things and have so much just knowledge that isn't taught in the books. So just amazing. So she knew exactly what I needed. So the birth of my son was Heidi, my doula, my nurse, and then my OB and my midwife, and that was it. And Heidi cut the cord, which was really an awesome experience. She had supported me so much in my journey, and it was really special for me to let her have that honor. That was a very special moment, too.
I'm sure Heidi was honored, I bet.
Yeah, exactly. It's just, it's awesome. She gives away these, gifts in the evidence-based birth class. And one of them is that she paints picture frames. And so at some point when I'm not in the throes of early postpartum, I'm going to frame the picture of her cutting the cord and put it in that frame. Oh. So it's just so special.
So how was the postpartum period and recovery for you?
So physically, postpartum was awesome. I recovered so quickly. I literally only had the saline flush when they started my IV, and that was the only medication that I had until postpartum, which I just took Advil. But my physical recovery was great. My son has lip and tongue ties. So fortunately, I had learned about those prior to experiencing that. So after the first night in the hospital, my mom stayed with me that night, which probably wasn't the best idea. She was out when she fell asleep. And so I didn't really have any help. And my nurse that night, just the most supportive. And so I didn't call her when I was trying to latch. And so I had bruises on both nipples the next day. So we figured out that he had tongue and lip ties in the hospital the first day. And I actually elected to have the anterior tongue tie clipped in the hospital. And that helped a little bit, but I struggled a lot with breastfeeding. And I had an IBCLC come to my house afterward and help me once we were home. And we actually ended up having to have his tongue tie revised via laser and have his lip tie revised as well. So developed mastitis in the first week or so. Week and a half maybe, was so sick. And that was so hard because I am a single mom. So my sister-in-law came to stay with us and cooked and take care of us, which was amazing. But at night, everybody would go to their respective quarters, and I was alone with my new baby. So the first night I went home, I actually hired the doula that took care of my mom. I hired her as my postpartum doula, which is some of the work that she normally does. She was amazing, and she has a lot of breastfeeding experience and knowledge. So she helped so much. And then that's when we decided that I was going to have the IBCLC come into my house and help me there. So finally, once we got started, I still struggle with breastfeeding a little bit. I have Raynaud's in my nipples, and so I end up having vasospasms, and my son does not have a great latch, and so he causes a lot of pain and pressure, but very proud that I've made it 5 months, and he's never had anything but breast milk, so we're working through all of that. I just healed so quickly, though, I think because I had no medications. Nothing changed what my body was doing naturally. And I think for me, that was exactly what I needed to do.
Yeah, it is really great for you that you physically healed really well and you had as normal a birth as possible because, like you said, you had to go home, on your own, basically, being a caregiver for 2 humans now.
Exactly.
So I'm really thankful that you were able to get the birth that you wanted. And it sounds like you were really resourceful in figuring out who could help you in the postpartum period and not being afraid to ask for help. And so that's really awesome.
Yes, that's a learning experience in itself, is learning how to ask for help. So that's right. I actually had somebody booked for the first maybe 2.5 weeks to be at home with me all the time. Sometimes it was one of my brothers. I have 3 brothers and no sister. So my sister-in-law came, and then my brother and his girlfriend came, and another brother came. So sometimes it was a man that didn't really know what to do with the baby, but everybody was very supportive and helpful, and it was wonderful. And I have a friend in my caregiving support group who had set up a meal train for me. So that was immensely helpful too, because that was one of my biggest fears. Like, how am I going to feed us even? It was quite the struggle when in planning, though, in logistics.
Right.
For sure.
Exactly.
Because you don't know when you're going to go into labor. So
yeah. Well, I know One of the reasons you wanted to share your story is you wanted other people who are entering birth and pregnancy and parenthood as a single parent to not feel alone. Do you have any advice for anybody who might be listening, who doesn't, who is what some people are calling self-partnered? You don't have that other person to help.
Yeah. My best advice is become self-aware enough to learn how to ask for help and know when you need help, because there's just a lot of this that you can be very strong and still not be able to do by yourself. So, asking for help from the IBCLC, I was fortunate enough to be able to hire a postpartum doula. I know not everybody has that luxury, but that's amazing, amazing, amazing help. And I also made friends with other single moms. I'm in a mom's group on Facebook, and I just saw someone else post that she was going to be a single mom. And so she and I exchanged information, and she was delivering at a different hospital. So we ended up going to the newborn classes for each other's hospital as our other partner. So that was really fun and just great to have that companion. And I ended up talking her into having a doula, and she's very, very grateful for that. So
it sounds like doulas are really critical for people who don't have a partner.
Absolutely. I think they're critical for everyone. Personally, that's my stance on that. But most definitely for someone who does not have a partner, for sure, or self-partnered, definitely.
If you had to sum up your birth experience in, one short sentence, what would you say?
It was the most incredible, hard experience of my life, and I am so glad that I had support and the right people around me to experience it with me and share in my journey.
All right. Everyone, thank you so much for joining us with this interview with Jenny and her incredible and also hard, but really rewarding birth experience. And thank you, Jenny, for sharing your story.
Absolutely. It's my pleasure. Thank you so much for all the work that you do, Rebecca. We appreciate it.